Hello, I'm Teri Schreiner, a neuro-immunologist and pediatric multiple sclerosis doctor at Children's Hospital Colorado and the University of Colorado. Multiple sclerosis, or MS, is a chronic disease that usually presents in adulthood and most often has a relapsing and remitting course in which neurologic deficits are disseminated in time and the lesions on MRI are disseminated in space. MS in pediatric patients is rare and serious, but also very treatable. For pediatric patients with MS, it is critical to manage the full impact of the disease on neurologic function, as well as monitor for any effects on school, development, and social functioning. Disease management includes not only disease-modifying therapies, but also strategies to optimize well-being. Children with MS have an exclusively relapsing and remitting course. In the first 6 years after diagnosis, the disease is highly inflammatory and the number of relapses per year is 2.3 times that of an adult at a similar stage of disease. Pediatric MS patients recover very well from their relapses, but it is nonetheless very important to prevent disease accrual from onset. The cognitive sequelae present early and may be insidious at onset. In fact, it is estimated that 25 to 30% of patients with pediatric MS experience mild cognitive changes, mainly involving attention and processing speed. Treating the disease can prevent or lessen these lifelong challenges. First, let's discuss disease-modifying therapies. These medications are an important strategy for brain preservation, especially for young people with MS, given the high risk of relapses. There are almost 20 disease-modifying therapies that can be taken to calm the inflammation of MS and prevent new disease activity in adults. One of these medications is FDA approved for pediatric patients. The decision about which medication to start should be made jointly between the neurologist and the patient, with the understanding that no medicine works if the patient doesn't take it. The best medication is one in which the patient can be adherent, with maximal benefit and minimal side effects. Adherence to disease-modifying therapies has been associated with fewer relapses, fewer MS-related hospitalizations, and improved quality of life, social, and neurologic function in patients with MS. Yet, despite these benefits of regularly taking disease-modifying therapies, 50 to 70% of the adults and children with MS will be non-adherent at some point in their disease course. Over the course of a lifetime, one's brain faces many threats: infections, trauma, aging, and chronic illness. Patients with MS have another threat: chronic and relapsing inflammation. A patient's ability to withstand these attacks is called neurologic reserve. MS patients can increase their neurologic reserve by using disease-modifying therapies to minimize disease burden and by living an active, healthy lifestyle. One powerful means to a healthy lifestyle is diet. There are many types of diets that have been proposed to benefit patients with MS. However, studying these diets in children and in adults is fraught with difficulty. What we do know from studies is that for each 10% of energy intake from fat, the relapse rate is increased by 56%. And this hazard is tripled when saturated fats are evaluated specifically. In contrast, each cup-sized serving of vegetables per day decreased the relapse rate by 50%. I counsel my patients to eat more vegetables, fish, and drink more water. They should eat less saturated animal fat, trans fatty acids, and drink fewer sweetened drinks. Fatigue is one of the most bothersome symptoms that my patients experience as it interferes with school, social, and family life. Exercise may improve fatigue by directly and indirectly impacting its biological pathways. Exercise can also positively impact overall quality of life and mood symptoms for children and teens with MS. There is a misperception that exercise for patients with MS will worsen the disease. The opposite is true. Importantly, minimizing risk is also a brain preservation strategy. Every effort should be made to minimize risk to the patient's brain, specifically by wearing seatbelts, helmets, and preventing bad habits like smoking. Unfortunately, mood symptoms are very common in both adults with MS and children and teens with MS. There is a lifetime prevalence of depression around 50% and an annual prevalence of 20%. Depression contributes to fatigue, cognitive impairment, social isolation, lack of exercise, poor treatment adherence, and yet is very responsive to treatment, both non-pharmacologic and pharmacologic. The multifaceted nature of this disease in pediatric patients requires a multidisciplinary approach. At Children's Hospital Colorado, we have assembled a team comprised of a neurologist, neuropsychologist, psychologist, social worker, research assistant, and nurse clinical coordinator. Annual visits with the entire team are recommended to ensure that all aspects of the disease for children or teens and their families are recognized and treated. We are one of a few sites in the country with this approach to multidisciplinary care for pediatric MS patients. If you have questions or would like to place a referral to our program, please contact us at the information provided. Thank you.